Punch in, punch out. This is a story for the folks who take a shower after work. Republicans are spending hundreds of millions of dollars attacking the Affordable Care Act, and they're lying about it. The full-scale assault on health care continues to mislead the public. This is what their summer has been all about. Members of Congress continue their crusade against Obamacare by filling the airwaves with negative speech.
We're not going to give up our quest to try and remove and replace Obamacare.
Filling out all of this stuff, you know, that's the trouble with one of the big problems with Obamacare. It allows the federal government to have all of your medical records. They'll know all of your deepest secrets. I'm glad I don't have any.
I was the champion of repealing Obamacare.
And do what is needed to make sure that government overreach is not involved in American health care.
Nothing is more important in regulatory reform than repealing every word of Obamacare, which I'm fighting every day to do.
Oh, yes. And all those papers that you have to fill out, too. It's just terrible. Don't be intellectually not curious. Don't let them get you down. Meanwhile, the president continues his cross-country tour trying to tell the truth about Obamacare. He made his 6th appearance on The Tonight Show with Jay Leno to discuss the upcoming changes in health care.
On October 1st, if you don't have health care right now, you can join what are called these marketplaces, and you'll be able to get lower-cost health care. Here in California, it's estimated it'll be 20-30% cheaper than what you're already getting, and we'll give you subsidies, tax credits essentially if you still can't afford it. So you can go to healthcare.gov, and right now you can pre-register essentially and start figuring out, is this plan right for you?
Does that sound like a government takeover? It sounds like freedom to me. You can join. Another advocate of the Affordable Care Act is Dr. Corey Hebert. Along with a few of his colleagues, they have compiled a document called Obamacare Made Simpler. The well-constructed 11-page guide helps basically break down the important facts to everyday Americans, similar to most members of Congress who aren't going to read 24 or 5 or 600 pages. Folks don't have the time. And quite often they don't have the intellectual curiosity to sit down and read a bill that's about that thick. I get all that. And that's why this is such a great service. I cannot stress enough that I believe that the American people can't be intellectually lazy on this. Pick up the phone, go to the website, read a little bit. Don't let somebody talk you down with lies, because a lot of what's coming out from the right especially simply is not true. And this man has made it easy for you to understand. No question about it. Joining me now is Dr. Corey Hebert, CEO of BlackHealthTV.com, an assistant professor at LSU. Doctor, why'd you do this? And what gave you the motivation to do this?
Well, I tell you what. Obamacare is the medicine that most conservatives and even some moderates don't want to take. But guess what? Obamacare Made Simpler is actually the spoonful of sugar to help it go down just a little bit easier. It's something that people need to be very aggressive about, because they're getting all these lies in the media and they don't understand that this is going to be something that will save their life, let alone make sure that they don't go economically bankrupt. And that's the real deal.
Before we go any further, where can our viewers get your Obamacare Made Simpler pamphlet?
If you go to www.blackhealthtv.com, there is a link, and you can just see it and you can read it, peruse it, do whatever you need to do to make sure that you get the real information. There's so many things in there. Nobody's going to read that whole document, but guess what? You need to read what I wrote, because several of my colleagues compiled this thing, and you need to get the real deal.
Okay, I want to put that up on our screen again if we can, because I've read it. And I think it is absolutely outstanding that you've done this. You've broken it down. You've answered some questions out there that are commonly asked. And is this really to debunk the lies? Were you motivated by all the misinformation that was out there?
Yes, and you know, I was really upset because the middle class are the people that are really causing the most problem. Let me give you an example. If you pay $300 a month for your health insurance and you've paid it for the last 30 years, you get breast cancer. What happens? You have to go in the hospital and you have to get probably a $800,000 bill. And then you have to pay the insurance company pays 80, you pay 20%, which is still about over $100,000. So what? You're economically devastated. And then, God forbid, you recur, and then your insurance company that you've been so loyal to over all these years, they cancel you. And then what happens? You don't have any more money, and you are economically devastated. Now what happens? That's not good for the country. You can't buy a car. You can't buy a house. You can't pay your rent. Your credit's destroyed. That's good for the country? I think not.
And you've seen this, obviously.
Absolutely.
And every doctor has seen this, have they not?
Absolutely. Okay. This is real.
All right. Do you think this is good for doctors? I keep hearing that doctors are getting financially shafted, and Obamacare is not going to be doing right by the professionals.
Well, I tell you what, you know, I'm a physician, and some physicians out there, we have to be altruistic. My job is to take care of people. Now, granted, I might not make as much money as I may have made in the previous years, but guess what? It's not going to be a lot less, and most doctors make a decent amount of money. I mean, it's not so much, especially when compared to some of the loans you have to pay, so no doctor's going to be the best, you know, I feel like this is the best thing for them, but they know that when they took that Hippocratic oath, that they said they're going to do the best thing and first do no harm. And this is what Obamacare means.
Dr. Hebert, this pamphlet that you have, how detailed, I mean, did you really dissect every sentence to make sure that this just isn't a generic piece that's going to get people through, that this really is well-researched and detailed and put and capsulized so the American people can consume it?
Right. Well, what we did was we searched the internet. We scoured the internet for the best and brightest people out there that have put things together so that it makes it simple. We haven't gone through every tiny detail, but for the masses, if you do that, it's once again creating the document, you know, so you don't want to do that. You want to distill it down so that the normal person can understand this. And also they don't get bored reading it because they need to know. I mean, for example, even just children. This is going to be a big deal for children because Obamacare eliminates the lifetime cap on benefits. If you have a child and your child, God forbid, has a heart condition at birth, that bill could be $1 million. And guess what? Some insurance programs actually have a lifetime cap of $1 million.
Do you think these exchanges will bring rates down? We've seen some coverage of that here in New York, in the state of New York, and also in California. Do you think that these states that go with the exchanges we will see premiums go down quickly?
Yes, I think you will. In New York, it's down by almost 50%. L.A., parts of other parts of California, it's going down. We know that this is the best thing that happened. And, you know, Chris Christie even said it right. Like, you know, the Republicans are all mad, but guess what? What did they offer? Nothing. So something had to be done, and this is the way that we're going to fix the healthcare system in the United States.
All right. Dr. Corey Hebert, great work, my friend. Thanks for coming on The Ed Show.
Thank you.
And I invite everybody to get that done.